Well, I think I mentioned trying to ensure that efforts around HIV are inclusive to end the HIV epidemic. Could be to actually include the women in the process. I think it's so important for women to have a voice in anything that is being directed toward them as far as behavioral change or intervention efforts or research in general. And this can be applied to the clinic setting, to their evaluations, like how are we doing to make sure that your voice is heard. So I think that is kind of first and foremost. And then I also think that we could kind of see what has worked in the past, and maybe a revamp of some of those things, kind of updating them to be relevant to now. There have been efficacious studies that have been done in the past that were wonderful, but they may just not be relevant to today's population. And so maybe a revamp of things that were in the past, but we can kind of jazz it up a little bit. Those are kind of the things that really come to mind about how we can work with this population in ending the HIV epidemic, asking them and then also utilizing what's been done, not reinventing the wheel, but updating it, kind of giving it a facelift. And I just wanted to emphasize how important it is to not exclude Black women because they are the group that is impacted by HIV, new infections after men who have sex with men. So they are a very critical, important group to consider. And so I hate for Black women to be the invisible group until something terrible happens. Like, we don't want trends to go up in order for there to be efforts for prevention for this group.